Welcome to another episode of the Being Human and Doing Psychotherapy podcast, where I'm curious about what is it that's human in the role of the psychotherapist and what is psychotherapeutic in all of us. Today, I'm really, really happy to be joined by Renata Senić, a psychologist and psychoanalyst. And she's joining me to talk about and unpack a really complex topic, which is narcissism. And we are going to try and make it not more simple, but at least more understandable. So thank you for joining me today, and thank you for accepting the invitation.
Thank you, Alex. Thanks for having me here. It's a pleasure.
So, as we discussed, I normally start this podcast by asking, what are some words that you identify with?
That is probably that is probably a more difficult question than talking about narcissism. But okay, because as a therapist, you don't really get asked about how you are and how you feel. I would say that I'm a very passionate person regarding things that I'm very passionate about, regarding certain amount of things that I'm interested in, which psychotherapy is one of them for sure. So I'm very passionate about my work. I'm very curious to understand why people are the way that they are and why I am the way that I am. And I like reading books and experiencing life, probably comparing it to what I read and,
Mm.
uh, you know, um, trying to uh, find the middle ground between the definition and books and real life. And other than that, which is more focused on my work, I really like spending peaceful and blissful time with my family. That comes with age, I think. I really value peace and going outside, spending time in nature, and just spending quality time with my friends and family.
Mm. And as I'm listening to you, I feel quite touched by the humanness of it. And
Thank you.
I was sitting with what is it? Well, to backtrack one moment, I really liked what you said about finding the right balance between reading books and actually living life. And I guess that's even for being a therapist is finding that balance between reflecting on something and being with something. And I'm
Mhm.
wondering how challenging was it for you and how maybe still is challenging to find that balance and what supported you to explore it and find it in the best way for you?
Yeah, it is. It was when I enrolled psychotherapy back in the day. It was not even psychoanalytic psychotherapy. I started as a CBT therapist. It was really difficult for me to learn something and then to apply it. It sounded completely impossible. Like how? Well, because you have to have this knowledge and then you have to apply this knowledge to and then, person is a person. It does not resonate necessarily to what you read in a book. So I think that is really complex and it only comes naturally after with experience, after you had lots of experience. And I mentioned that to you earlier. That is something that I heard from a professor of mine when he told us, he's a psychotherapist himself, when he told us that we have a very important task of learning everything that is there and then forgetting all of that when we actually work with a client, with a person. So we can be there for that person, for the person's experience. So it is somewhere in the back, something like a tool that can be helpful, but not necessarily,
Mm,
because the personal experience of the person is always so much more important than what we read in books.
mm. I can relate that. um, and then we can maybe jump into the topic of narcissism and to answer the question, what was the first attraction to the topic? And what is it that kind of pulled you in? Because now, as far as I can say from your posts, you are fully in.
Yeah, I do talk, well, I do write about narcissism a lot more often nowadays, probably because I would like to clarify some things that I don't think are clear enough when I here and there hear some reels or YouTubers, or it's not that I'm sitting and listening to everything that everyone has to say about it, but I think that it is like a pandemic of people talking about narcissism, and some things do not sound right, or they're overly simplified, or sometimes just plainly not correct. But I started being interested in the topic of narcissism when I was a student of psychology, because one of my favorite professors was a psychotherapist. He was educated in psychoanalysis, and he was talking a lot about the importance of narcissism and how we live in the narcissistic age. I think it was back then, it was still narcissistic culture. Now it is perverse culture. We moved on in a bad direction. And I got interested in what he had to say, because he was a really a good lecturer, and I love listening to him. So I chose that as my final work in psychology, as my thesis, wrote about that. Then furtherly, I enrolled psychoanalysis, and when you learn about in-depth psychology, you understand how narcissism as a phenomenon, not narcissistic personality disorder, but narcissism as a phenomenon is so very present in nowadays almost every disorder, not personality disorder, but every psychological problem. Like panic attacks have problems with narcissism, obsessive compulsive problems have problems with narcissism. The narcissism is underlying problem in its various forms in many disorders. And because I work with people for I don't even know how much now, let's say 15 years, I work as a therapist in my private practice. That is what I hear from my clients. So I think that it is absolutely necessary for a therapist to be well informed of what narcissism is and isn't, and different phases of narcissism.
Mm. And interesting, when you said something about that, exactly this morning I've read something, self-sabotage is a need to control, and I thought how poignant that was the first Instagram post I saw this morning, because there is something, and maybe let's unpack the word control, because I think what people hear in the word control and what people who know things about narcissism think of the word control is probably quite different. So I would like to hear what your idea of the word control is, and how do you see it playing out in the therapy room, or like in a wider social circle?
I think that is something that is in human nature, and that most of us, if not all of us, would like to be able to control things. But the more pronounced the tendency to control things is, you can actually understand that the more problems there are in the person, more insecurities, um, more expectations of catastrophic events possibly happening, unless we are very, vigilant and anxious and try to control absolutely everything. So I am not sure what you meant by it specifically, because people can try control other people, they can try and control themselves. Some people try and control their dreams also, and fantasies and thoughts, and are scared that if they think something that can happen, That goes with specifically obsessive compulsive clients, for example. So there are forms and forms of control, but I think that underlying issue is always fear, insecurity.
And I'm sitting that when it comes to me, one thing that came to me as I was saying the word control is that I think many people think that it's a conscious process, as in like someone decides to control either someone else or their thoughts or whatever else the thing is trying to control. But what in my experience is, even when it comes to my own processes, is that control is not something that you want to willingly exert. It is
Absolutely.
often something that's coming from, as you said, a deep-rooted fear and probably a very old experience where we didn't have control.
Yeah. When we didn't have control, we also had lots of negative experiences. Because if the experiences were mostly positive, we probably wouldn't feel the need to control everything. We would be able to relax, somewhat relax, right? But if the experiences were vastly negative, then yeah, of course we are gonna try and control what is happening because we are expecting the worst, right?
Yeah, yeah. And can we then at this point start to introduce the definition or the working definition of narcissism that you are operating with? Or all
Mhm.
the definitions that you are aware of and that were that and give maybe some nuance to that term.
I like the idea of like a work definition because I am not going to be able to mention all the authors that gave their own definitions. I like to think about it as first of all, I would like to say what in psychoanalysis is considered as narcissism, and then to give a work definition of what pathological narcissism would be. And I told you that in psychoanalysis we use ugly, long, not understandable, not easily understandable terms. So I'm going to translate everything that I say. So from very early age, from the beginning of our life, we are dealing with the life force that we call libido, right? And in order to be normal, whatever that means, in order to operate in a balanced way, we should normally invest our life energy into outer world. So in psychoanalysis, they would say objects, but that is goals, people, animals, whatever it is out there. What happens that is what normally happens with a child, with an infant, when they start crawling, when they start experiencing their new capabilities. They now can move, they can put things in the mouth, try the world out and everything. So that is like a normal phase, normal narcissism. But what happens when they're not met with empathetic environment, when the mother or the primary caregiver uh, frustrate them too much or not enough, meaning neglect them, when the mother is completely uninterested, depressed, angry, whatever could be considered as a too big of a frustration, then the child tends to withdraw. And this is not what we call object libido, which is life force invested into outside world where we are ready to explore and seize the day and find and become adventurous. But we form something that is called narcissistic libido, and that is withdrawing life force into one's ego. And when I say ego, I don't mean vanity, the term that we like use it in slang. In that way, I mean ego, that is the central structure of our personality. And I think that this is important to say, even if it needs, you will tell me if it needs further clarification. I think that it is important to say because this is how we um, uh, get to deal with people who are completely withdrawn and invested in themselves, which I think is one of the main characteristics of, let's say, a work definition of narcissism. And, people say using the slang that people have, narcissistic people have inflated egos. I don't think that is a correct usage of a term, but in a sense it is, because if you draw everything, your entire energy, your entire life energy is inside you, then you become inflated. Like the parallel would be when your entire life energy goes into another person, then you are madly in love. That person becomes the center of the universe because that is all that matters. When you withdraw it to yourself, then you are madly in love with you. But I don't think it is that simple, because you cannot possibly withdraw all that energy without consequences. And consequences are symptoms, psychological problems, very severe psychological problems like narcissistic personality disorder, other disorders as well. So, work definition of pathological narcissism would be, I would say, massive introjection and a creation of a fantasy world within a person, where the person gets to experience him or herself as everything that it is not in the outer world. So in the outer world, it is small, insignificant, feels neglected, abandoned, unloved, and so on and so forth. Within the fantasy is big, it's omnipotent, omniscient, can do everything, does not need anyone, and so on and so forth. So that is like internalization of all that is good and ascribing that goodness to what is popularly called, the term coined by Donald Winnicott, creating false self. Does that make any sense, or
Yes,
does it need
it does. It
further
does.
clarification?
I think it does. And I think what we can maybe explore further is what is the cost of doing that? And what is it? Because again, there is, I think, the false notion that having that inflated self is somehow also good for the person, which, as you mentioned, it's probably not going to be. So maybe we can speak from the therapy room and from your experiences. What is it that the costs are, even for the people that it looks like that they're quote unquote self-confident because of that?
Mm-hmm. Well, first of all, they're not self-confident at all, because if they were, they wouldn't have the need to do that. The development would take a different path. They have lots of self-doubt and self-loathing, and but probably the worst and the most severe consequences that they are not properly in touch with reality. They cannot be, because if they choose to abandon the reality because it sucked for them, it was so painful, and to create a fantasy world, even though they are not psychotic, we say for psychotic people that they lost the touch with reality, so they're not psychotic, but they spend so much time living in their fantasy world, their touch with reality cannot be good. And in order to do so, they have to massively use what we call primitive defense mechanisms. They have to deny the existence of outer world. They have to deny that there are people there, for example, that don't like them, because they cannot tolerate that. They cannot stand that. They also deny that they have vulnerabilities and faults and flaws. They cannot stand that either. They have to split people and reality into all good, into all bad. And they have to project, because as I said, the formation of pathological narcissism implies massive internalization of what is good, which is ascribed to the self. That means that because we are all good and bad, that means that all that is bad needs to be projected into outer world. So that is a very distorted picture of reality. And when you can't see reality properly, there is no way that you're going to be satisfied in it and with it.
And I'm sitting with, and we could maybe unpack it now, what it means to treat a person with NPD or any, well, maybe probably when you get to the narcissism part with most of, as you said, most of the challenges we have. Because to backtrack a little bit, that was also part of my process to see the small wounded child in me. And also there was a moment where I remember um it was actually this winter where I was most like almost I had a taste of my own wounded pathological narcissism, and part of it was playing out in my scientific role, as in like taking on the scientific role, because science is a thing that you use to control in some way. And I remember I had a physical experiment where I was basically asked to imagine how am I interconnected, or to see a galaxy of interconnectedness. And I was a baby outside of that huge galaxy. I had an internal image of that. It was absolutely, it was quite terrifying to get in touch with it, but also quite liberating to see my own wound. So I'm wondering, what is it that uh, what is it how is the process of getting to that place with a client, and what it means in terms of grieving when you do come to realize that this is somehow how you lived your life for, or not, some people predominantly, some people to some extent, but still there is always that part of us that kind of guides us in that way.
Well, that is a very complex question for many reasons, and I would think maybe because it can't be fully answered like as in unison as a one answer, because there are types and types of people with narcissistic personality disorder that are less severe, more pronounced, etc., etc. And it is that is one thing that I also heard online, that narcissism is something that is on a continuum until they reach narcissistic personality disorder, and then after that that's it. That's like a fixed thing. That's not true. That is not true. There is everything, a continual process in every disorder all the time. We don't really we don't have fixed categories, but specifically grieving is the top emotion, the supreme emotion in therapy, and that is something for people who do not have personality disorder. That is something that takes a lot of time for them to get to that point in order to be able to fully grieve, because that is beautiful and difficult, and that is when we know that our work is done, you know. Someone is capable of accepting and grieving and letting go and fully accepting of being a fallible human being, and you know, containing all the emotions that are there. So I think that is so much harder to achieve when we work with people who have personality disorders, because we have to deal with primitive defense mechanisms, with early traumas, with something that is very far away from grieving and from vulnerabilities. And some people with narcissistic personality disorders, even though there is another myth that says that people with narcissistic personality disorders do not come to therapy. That's not true. They do. They do not come to therapy saying, I want to get rid of my narcissism. It is not like that. But they have, when they experience problems, uh, uh, divorce, failed careers, alcoholism, gambling, impotence, sexual problems. When they realize that they don't, they would say, function as good as they did before, they do come to therapy. And if we manage to form a good enough relationship with them, they can stay in therapy and even consequently a lot later understand that their pathological narcissism is actually in the way of them living a fulfilled life. But vulnerabilities and flaws and faults and even sadness, or they, even though they are filled with shame, they are even ashamed to talk about shame. So all these emotions are something that we do not mention early on in the process. It takes a lot of time, a lot of empathizing and listening and just reflecting and being there in order to be able to even mention things like that. So it goes on for a long time.
And I think you mentioned one thing that is a myth, which is that they don't come to therapy. And maybe I want to hear more about that. And as in, what is it? You've mentioned also what brings them to therapy, but I guess I would want to hear more about what keeps them in therapy, and also what happens when there is actual change, because I think the unfortunate thing is that many people cannot witness that. I mean, I read somewhere that therapists see the worst and the best of humanity, because in a way we see people's ability to actually make meaningful strides in their lives. So in a way, I guess because that's not visible or not talked about enough, then there is this big stigma around what it means to do therapy for people with narcissistic or borderline personality disorders, or any in the
Personality disorder.
spectrum. Yeah.
I think that it would be better. At least this is how I think of personality disorders. I think of what Kernberg called borderline organization, where he placed all personality disorders. Some of them are less severe, some of them are more severe, but it is the organization that holds all personality disorders, right? And I really like that ICD-11. I don't know if you use it in England. I don't think that we started using it in Serbia, that removed the multiple diagnoses of personality disorders. So now you have one personality disorder with certain styles. So personality disorder, which has dissociality, anancastia, negative emotions, would be something that resembles previous narcissistic personality disorder. So I think that it is a lot easier to think of personality disorders, generally speaking, than like of them as distinct categories. Again, I don't think that they are as distinct. And as you know, there is lots of morbidity when you diagnose people. That's not. I'm a therapist. I don't work as a clinical psychologist in an institution, but I think that that has more sense to me. And I believe that it comes from
Can I pause
psychoanalytic
for a
perspective.
second here, because maybe I want to ask you, in your practice, how it is or it isn't useful to use diagnosis, because
I don't use
yeah.
I don't use them. I heard that psychiatrists in our country have to, if you ask, or maybe if you don't ask, tell you, well, they have to because it's written in a report.
Yeah.
So they have to they have to tell you about your diagnosis. But I never do that with my clients, and my clients don't even ask about that. It is very, 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 or it happens very rarely that someone asks. And when I explain to them how I think of it, and I think of it that is just, a degrading person to something that is an F, and it's not them, and what difference would it make if they had that, because they would still be the same person. So I invite them to explore what kind of person they are, what is it that they would like to be, what is it that they would like to get rid of, and so on and so forth. I don't use them. I do not find them useful, especially not to talk to my clients about them. I think that it is useful for us, therapists and clinicians, to understand, based on the quality of anxieties and the defense mechanisms, what kind of organization, not disorder, but organization person is functioning in. Which, is it neurotic? Is it borderline? Is it psychotic? I think that is very useful because we know how to talk to them in a better fashion when we recognize the dominant defense mechanisms and the quality of anxiety. But that is for us. It means nothing. Even if we told that to our clients, even if we share that with them, I don't think that they would, what would they do with that? It does not help. What was the question?
So we were talking about what it means to have a meaningful stride in therapy with personality disorders, and what it means to actually see and witness change, and how does that change? How can that change look like, actually?
Right. So, what keeps them in therapy? The therapy for people with personality disorders is usually not pleasant at first. Well, at first it is, and then it becomes unpleasant because there is this saying that it gets to be worse in order to be better. And sometimes, a lot of times, especially with people with personality disorders, does get worse. And then I usually use this comparison to going to the dentist, how it does hurt, but it hurts in order to be better, in order, to fix cavity, to help, or any other doctor. Sometimes it hurts, but it hurts for a good cause. But why is it painful for them? Because it is painful to get rid of omnipotence. It is painful to get rid of the fantasy world, and it is painful to understand that themselves, like us, like everyone else, that we are just all fallible human beings. That is very painful when you are so very hurt as a child that you have to create this compensatory defense structure that convinces you that you are infallible and omnipotent and omniscient and the best, the godlike figure. It is super, super painful to let go of that. And then clients who cannot tolerate that kind of pain, they leave therapy. There is even, I thought that was funny. There is even a meme saying I used to have superpowers until my therapist took them away, which is that.
Yes.
That is talking about omnipotence, and because they do not trust, which is logical. Why would they trust that there is something better on the other side, but they never experience that? So that's a huge leap of trust, to just believe in you and to believe in the process and to get rid of something that really helped and saved you when you were small, in order to try something that you never experienced before, and could be this, could be that, maybe it will not work for me. And people who do believe, who really want to get better, and who are aware that they're really struggling with whatever their personality disorders bring. It's like a ton of anxiety, isolation, failed relationships, failed careers, whatnot. Sometimes that's like a straw, the last straw, and they hold on to it and they do believe, and it is always a struggle, and it is full of anxiety and anger and negative emotions, negative transference and counter transference. That part of therapy is very difficult for the client and for the therapist. But if we both endure, it gets better. It gets significantly better.
And that's it's really funny because I can also remember my parts of therapy, which it was some kind of an internal hope that what I don't know, or even these days, my diaries are full with, I cannot imagine the life in front of me from my past, so I really need to surrender, because if I continue imagining it from how my experience was, I will just get more of the same in some way. And and that's a really difficult part, because part of the therapist is to hold hope, and then the client or us, we then start to hold that hope for ourselves. But it is I remember also those really tricky parts of the process where it's just so easy to give up on that hope, and it's so easy to just be like, oh, like, just it's it's less energy consuming, but then in the long run it is actually less energy consuming to do this work, but it's not something we can see from that point.
It is not possible. So that is why it is amazing how some clients allow themselves to trust the process, to trust the therapist. That is really, it's like it is amazing. It is awesome. It is, and after that, clients who actually went through transformative therapy, after that, they're so grateful, which is very gratifying for the therapist. But they, when they look back at that time, they do remember how it was awful. But also, there is another thing that it's not just trusting therapists. It sounds too optimistic, I think,
Yeah.
and it is not like that. Many of them say, I hate starting therapy because I can't go back.
Yes.
I'm more self-aware now and I can't go back. I already lost some of my superpowers and you got me to start thinking in a different way. And all I do now is obsess and think. And it is awful, but I can't quit now because, I'm hooked in. And then they hate us,
I know.
which is also very, it is legitimate. It is understandable. They hate us because, like, you did this to me. You
Yeah.
invited me. You promised that it's going to get better. And then, again, most of them at that point, they continue and then we work through that. But work through that sounds like something that we just, manage. It could be years of working through that
Mm.
until we actually circle it properly and
Mm.
make sense of all of that.
Mm. And I do remember that part of my therapy. I think it's part of a lot of therapies, but I do remember a moment where it wasn't necessarily directed at my therapist, but it was directed at the fact that I can't see anything in front of me, but
Mm.
I have enough knowledge at this moment that I can't go back.
Mhm.
And it's really soul tormenting. it
It
is
is.
it is really, really hard to do that. But I kind of I think with really supportive therapy, it is beautiful when you kind of get on the other side.
Mhm.
And I remember Marion Woodman, she speaks about life is a series of birth canals, and that is a little bit as painful as being reborn in a different way.
It
Um,
is.
yeah, yeah. And I'm wondering, speaking about this, um, because what we know is that this takes quite a long time, and in a way, the we can now come back to the people who are involved in relationships um, with people who have either personality disorders or just struggling through something, um, because it takes such a long time, and it might be really hard. Uh, how can they be best supported in that process um, without being hurt? And what it entails when you are on the other side, when you are in relationship with a person like this, and then we can maybe go into how can one take responsibility in that place as well.
Mhm. You are talking about narcissistic relationship, romantic
Yes.
narcissistic
Well, it doesn't
relationships.
have to be romantic. It can also be jobs or like wherever there is an impact, a relational impact. Yeah.
Mhm. Yes. Okay. I mostly work with individuals. I do sometimes, rarely, work with couples, but I mostly work with individuals. And uh, when people come to therapy seeking help because someone is rude and crude and molesting them, they, regardless of whether they have personality disorder or not, they feel like victims. And I think that it is our tasks as therapists, again, like every other time with every other client, is to listen carefully, to empathize, to validate experience, because uh, whatever it is, truth. If there is such thing, that is their truth, right? It happens, however, it happens that a very narcissistic person feels like a victim without realizing that they are making problems. They just feel victimized and neglected or abandoned by other people and wronged, constantly wronged, which is something that is typical for people with personality disorders. They are constantly wronged, and something is always someone other's fault, right? Someone else's fault. So I think that it is super important to understand the entire story, to connect it with childhood, to see how these people were treated as kids, what kind of life messages they got from their parents. Were they in any shape or form mistreated? And most of them were mistreated or neglected, and how that uh, influences their way of viewing life nowadays, life, and also their way of reacting. And that is something in psychoanalytic therapies, at least, that is also experienced through transference, because the way that they treat others or behave towards others is going to reflect in therapy. They're going to try and form the same relationship with the therapist. So through specifically through that transference, counter transference experience, we can understand what actually is happening in the inner world of a person who feels victimized and tormented, and from that point, we can design the approach to help her or him the best.
Hmm.
I don't know if I answered your question properly.
Well, what I also want, you have mentioned the position of victim, and maybe we can go into um, how can we avoid victim blaming, but also empower the victim to then take the responsibility for what's going on in a relationship or in their lives. Because what I've when I've spoken to one of the therapists that I worked with, she mentioned at one point, well, you need to acknowledge you have been a victim before you can move on. Which was a
Mhm.
very useful thing to hear, because sometimes we don't even acknowledge that part, and then it kind of starts to play out. But then there is, when you do acknowledge, sometimes people identify with that and
Mhm.
continue living their life as if they are continuing to be a victim.
Mhm.
And then I think it really plays out in how these relationships are portrayed in the media, in the
Mhm.
sense that there's always a bad guy and a good guy, or a bad girl and a bad and a good guy, or or the other way around. And I am just wondering, how can we bring more nuance to these dyads and to these relationships, and also like maybe demystify the victimhood a little bit.
What you just said reminded me of well, we mentioned that the dichotomy, good and bad, and the abuser and the victim, but I don't think that we have mentioned the victims that are also narcissists. And of course, we have to acknowledge that we have a problem in order to overcome the problem. I mean, how else would we be able to overcome it? But in my experience, like real traumatized victims, probably victims of psychopaths rather than narcissists, did not know that they were victims. They did know that something bad was happening with them, but when you go through severe trauma, when you are not only verbally but also physically and sexually abused and treated in completely inhuman conditions, something that is so hard to listen as a therapist and unthinkable to the person that went through that. That is what happened actually. They cannot think about it. So when they come to therapy, as a well-known Stockholm syndrome and things like that, they defend the abuser. They justify that. They would say that he ingests or she or she. It is really important not to call narcissists male because there's so many female narcissists who are also as abusive as male narcissists, maybe using different tactics because they can't really probably beat you, but also they can beat you. There are many beaten men, physically beaten men. So when someone degraded you so hard, you cannot think about what this is the part of trauma. This is the outcome of trauma, the inability to think. And this is actually what happens in the formation of personality disorders that are reaction to trauma. They have, in their early childhood, the inability to think properly. They cannot form abstract symbolic thinking. They cannot properly think because everything was disrupted. Everything was chaotic, nothing was predictable, nothing was there in a harmonic sequences in order to allow you to predict with accuracy, right? So in trauma later in life, even if you didn't have any kind of a personality disorder, when you are so abused like that later in life, you start behaving like you have a borderline personality disorder or worse. You can't think, your defense mechanisms are broken or become very primitive. It really reduces you to a very regressed state, and it is really horrible. It is really horrible. You don't believe yourself. You don't know what you feel. You don't know what you think. You can't think, basically. So from that point, to get someone who was so severely abused to start thinking about themselves as a victim, that first step takes a long time. To help people that were abused like that to start feeling anger and I think absolutely necessary hatred toward the abuser, that also takes a long time. A really long time, sometimes many years. You know, so it is really important to acknowledge that you were a victim, that someone was mistreating you wildly. That was not okay. In order to accept that, in order to then be angry and then start grieving. And, people are like, no, you should forgive. Some other people are like, you shouldn't forgive. Let's not go into that, whatever. In order for you to be able to think again, thinking is extremely important for our mental health, like reflecting, actually thinking before doing, before, not impulsively making decisions, just like going around we're all like a headless chicken, but sitting and thinking. That is extremely important, and trauma ruins that. But on the other hand, there are, I would say, with a bit of fear right now, that they are so-called victims, not real victims, you know. And I say with a bit of fear here because I believe that people will not like hearing that. And when I say so-called victims, I mostly talk about two disordered people forming a relationship where they mutually abuse each other. Uh, Having personality disorder or a bit of personality disorder or a lot of personalities, you know, does not matter. So they are mutually molesting and abusing each other and treating each other with disrespect. And there is verbal abuse. There is usually lots of drugs and alcohol involved, and um, lots of chaotic behavior. And then something happens, they break up for some reason, and then there is one of them saying, I was gaslit, this person caused me to behave like that, I didn't want to behave like that, I'm not like that in I was not like that in previous relationship, I was never like that, it happened, you know.
Mhm.
I think that these people should not realize that they are victims. I think that these people should realize that they are abusers
Mm.
in order to move on, that they have problems that are mainly unconscious, and that they were led to people with pathologies that would fit in with their pathologies, that also have mainly unconscious mental problems and underlying issues and whatnot, and that they unconsciously needed to co-create trauma that was happening in their early lives. So no one is to blame there, you know.
Mm.
They created that because they needed it. They needed to act out that.
Mm. And this is, I think, whenever one of the favorite answers from all of our trainers is it depends. So I think this is a really important distinguishing, because when we there is no one umbrella for everything that's happening and one term to cover everything. And even within what you described, there is probably a continuum. And also,
Mhm.
it is not on us as therapists also to pre-design what's going to be a therapeutic process, or decide whether someone is a victim or not. It is something, I guess, which emerges with the work,
Mhm.
and for the person. And I think I guess I understand your trepidation to say this, because obviously it feels like someone might be labeled, but actually, at the end of the day, that's not what we do when a person enters the therapy room.
Mhm.
And we don't think, at least that's how I perceived what you were saying, is that there is no thinking of what should happen, but it's what
Mhm.
emerges from the work. But I guess the danger is when we try to explain this outside of therapy room without actually sharing stories of the people who have been in it. It kind of goes into a more generalizable field, which then basically loses all the nuance of the one-to-one work. But one thing that I kind of, as you were talking about this victim and victimization and the whole process, what I'm also sitting with is, so how we societally normalize abuse. And I mean, this might be my my quite a big generalization, but um, at least it feels at times that there is also something about searching for the perfect victim. And if you are not like this, then you don't really fit the description. Um, and how, in a way, we normalize trauma responses as success. As in someone who is overly intellectualizing, for example, going into science or being extremely successful or having successful companies, but actually the underlying driver is a very traumatic history. Somehow we almost glorify it. We don't even name it as a problem, but it becomes so glorified that even the person who has the problem then cannot reflect back that there is something there. So I'm just wondering, because you work one-to-one, I assume you deeply believe in that having an impact. But I also wonder, what do you see the society's role as in supporting people to maybe either come more to therapy or to not normalize things that are actually quite disruptive. So yeah, I don't know if you've heard my question or what you heard in my question, but maybe you can clarify it if it's not clear.
I think if I understood you properly, the impact of society is undoubtedly huge. And as I mentioned earlier, that we moved from narcissistic culture to perverse culture, I think that there is a trend nowadays to normalize what is not normal, but to pathologize maybe things that are and should be normal. And that is like the definition of perversion, upside down. Everything is inverted. Normal is not normal, good is bad, blah blah. So yeah, as that is a part of capitalism, I think that is a part of the way that we do live nowadays. That it is completely normal that you, as a woman, have to be a great mother, and you have to work 16 hours a day in a corporation because that is how you show that you are dedicated to your company, and there is lots of stress, and people are super unhappy about it. And then there is another thing that definitely is connected to narcissism, and I believe these pandemics of narcissism, which is social media. And when you are stressed the way that you are stressed, of course, workaholism is trauma response, but it is valued better than alcoholism, because it contributes to the big boss. Alcoholism does not, right? So, of course, many isms are response to trauma. But then again, when we are so alienated from one another, which is also one thing that I would definitely include in the definition of pathological narcissism, is the alienation. So you live in your fantasy world and you are alienated from other people, and you don't see people as they are. You see them as your fantasy tells you to see them, as you want to see them. And isn't that the same thing as what we are doing when we are using social media? So I think, and also we don't have time to spend quality time with our families and friends in person. And then we are using social media as a substitute. And social media in itself, it looks like a very narcissistic thing. So we are spending time in fantasy. I can project whatever I want onto you. There is not you in flesh here to test my hypothesis, right? And I have this illusion that we are together while we are really not.
Yeah.
And so on and so forth. So I think that the climate nowadays is basically very fruitful to raise more and more narcissism and brings out more and more perversion and perverse behaviors.
And actually, this is exactly what I was speaking with a friend of mine yesterday. We were really reflecting on that feeling of things being upside down. Especially, we were talking about the biotech industry and how easy today is to quickly sell a company with a drug that you haven't tested enough without the idea that this is going into actual humans. I mean, first into animals and then into actual humans. And in a way, how it is not normal to actually sit and properly check your data and take time and somehow it's exactly, I think I used exactly those words. So it's really nice that you've now named it, because I realized it just feels like this is the movement. It just feels like it doesn't make sense, and it feels everything is upside down, but like it's really hard to grasp it, or it's really hard um to in a way name what's going on, because it's now feels so normal as if everyone is and should be doing that, where internally I kind of, for myself, I feel like it's not aligned with my own integrity, or not aligned with the values I have. But I'm wondering, in that sense, what is that an individual can do, um, maybe having the awareness of that and still kind of be able to um, kind of persist in this society and not be utterly desperate.
How to be normal in a crazy society?
Yeah.
That is a question. Yeah, it's a good question. I think what you just said, like you send something out there that can have horrible consequences without thinking. So thinking, just mention thinking, inability to think as the outcome of the trauma. Thinking is really important, and we don't even have time to think.
Mm.
So even though I'm a psychoanalyst and we don't use techniques in a sense of homeworks and journaling and things that you can do after the session. I think that what is offered nowadays can be really, really helpful to help you think. For example, journaling, to collect your thoughts, to form not just journal, whatever, whenever, but to form a habit of doing that. That is something that is definitely very helpful for people with personality disorders who do not have a cohesive sense of self. So they can uh, form a continuity and then go back and read what happened there. But I think that it is good for everyone
Mm.
to sit and because when we are actually writing something down, we have to think about it. So it
Mm.
forces our thinking and meaningful relationships with other people that someone just asked me just recently asked me, you have to have as a therapist, you have to have means to defend yourself from all that stress because people burden you with their stories, and they probably teach you how to defend yourself. And I was thinking how, yeah, they did teach you how to recognize counter transference and things like that, but I was also thinking my therapist did not burden me. Other people can, but my therapist do not therapist patients do not burden therapist patients. It's a good slip. They do not burden me because they talk honestly and openly. That's a real talk.
Yeah, that my
And when
mom
people,
asked me the same question, and I felt like this is the most honest conversation. It feels real. It feels
yes,
the
it is
realest.
free.
Yeah. Yeah.
There is flow. People get angry, we cry, we laugh. I don't cry, but I sometimes do feel like crying. We get angry. I don't show my anger, but I also it's like emotionally charged, the real experience.
Contact. Yeah.
Yes, full on contact. And that is something that you really don't experience when you chit chat, when you go outside, walk your dog and
Yeah.
see a neighbor. It's not like that. So that is
Yeah.
something that can be really burdensome, but real contact is not
Yeah.
burdensome. So when you have at least one friend that you can talk to about whatever, just whatever, the way that you think, the way that you would probably talk to your therapist, that is so healing. That is
Yeah.
so important. Yeah.
Yeah. Yeah, that is I can really relate to that, because otherwise there is a perpetual living in a sort of a mask or a persona, and that is very energy draining because it involves a lot of, again, it regresses us to some point because it requires using some of the primitive defenses. Well, some defenses, not necessarily all primitive, but I think I agree that it is often my experience that I go from my therapy sessions, not but both as a therapist, but more as a therapist actually, energized. Because it was difficult, but it was real. It was real, and it felt like for both of us, something inside has kind of had a full gestalt in gestalt terms. So yeah, I agree that to me it's a very important space to cultivate. Yeah.
And that is something that is something that people with narcissistic personality disorder cannot do. And
Mm.
that is why they feel so lonely and alienated. And that is why their worlds are so empty,
Mm.
because they dread and hate their vulnerabilities. And they would rather do anything else than show them to you or to themselves. They deny them, right? We started talking about how they have to deny that. So when you actually get to talk openly with a person who has a narcissistic personality disorder, you basically know that that's not the same quality anymore. Something has changed severely if they can actually start talking about their vulnerabilities. It takes a lot of time and a lot of effort, but that is something that is really transformative.
Mm. Mm. And I want to maybe ask you here also, is there any myth about this whole field that you feel we haven't mentioned, but you feel like you're encountering it over and over again, and it's draining to see it over and over again?
Well, I don't know. We probably did mention that, but I would like to stress that because it is wrong, and it is wrong to think in these terms. So it's not black and white. Narcissists aren't evil; they're ill. They're not evil.
Mm.
They're not evil. They're ill. They're ill people, and um, also there is a common misconception that they lie a lot. And I'm sure that they do because everybody lies. I'm sure that narcissistic people
Mm.
also, just like everyone, the victim, the children, mothers, fathers, everybody lies, But also because they are ill, sometimes they see things differently. They disassociate a lot. They're half in reality, or maybe less than half in reality, and a good portion of the time in their fantasy world. And then, as mentioned before, because of the massive usage of primitive defense mechanism, they see the world differently. So when they tell you that something didn't happen, there is a good chance that for them it did not happen. Or when they tell you that something happened differently, there is also a good chance that they do believe in that.
Yeah.
So I don't know why. One thing that is mind-boggling to me, in my opinion, is why people dwell on that so much and so hard. Because I think that this is important for the narcissist, because uh, they suffer with their dissociation and living in fantasy and all the memory problems and all that. I think that this is important for the therapist in order to understand the client and to find a way to help them the best, right? But I don't understand why is that super important for the spouse, for example, or a girlfriend or a boyfriend of the that kind of a person. Did he really lie? Did she really mean that? Was she
Mm.
aware? And also this notion of self-aware narcissist, and then people say all of the narcissists are self-aware, then other people say none of them is self-aware. So it's always all or nothing. I don't know what it means. Narcissists people with narcissistic personality disorder, just like other people with problems, do know that they have problems. There is no such thing as being not self-aware of it. They do know that they have problems. Some of them, they do not want to change. Other, they would like to change. But being aware of your compulsion will not stop your compulsion. It means nothing. Just the same goes with lying or confabulating, which narcissists do often because they lose touch with reality, and then they disassociate, and then they fill the gaps with what they think is probable that happened. What does it matter? If you find yourself in a relationship with someone who is not stable enough and is not responding to you properly and is constantly forgetting things and seeing things differently, what matters, what should matter, is that you two have a problem and how to address this problem. Will that person admit that there is a problem? Will that person be willing to go to couples therapy or individual therapy if they want to change something? Or is it going to become a blame game, which then can actually be classified as a pathological or maybe even perverse relationship that should probably be, broken up?
Yeah, that's a very important thing, because for me, again, having gone through a really challenging relationship, I think for me, having names for the whole process, as in having names for love bombing, for stonewalling, for all the things that they happen, it was really important for me to actually see that there is a problem, because of my history. Obviously, I couldn't see that there is a problem. I was only and then that gave me names to see, aha, this is happening, this is happening. Once you realize, once you have that awareness, then it's much easier to say, this is not what I want. And then I think what I want to add, I want to add here, as in speaking from personal experience, because there is this idea that there is an intentionality in someone's behavior, and especially in the narcissistic personality disorder. And in my experience, it's really not an intentional process. It's not like, I'm going to manipulate this person in this way at this time. It's I don't know, having lived through it experientially, I found it quite incredible how unconscious the process is. And in a way, how unconsciously we also play a part, or like I played a part in this whole process. But I also that's exactly what you've mentioned. I really like, there's a really good, again, it was circulating on Facebook, but it was like, when a snake bites you, you don't think about what was the snake thinking when they bite you. You really need to deal with the pain and the fact that your life is threatened. I mean, this is really extreme, but in a way, that was a very useful metaphor for me to not jump into mentalizing the other person, where actually I'm in pain and I need to acknowledge my own pain, and to see from how much it hurts me and what's my capacity to decide whether I want to take more of this or not. And that's where my agency basically was lying, knowing that at least that's what I needed, is to hold the compassion that they're not doing this to me, they are doing this, and I'm having a hook to that. And and to also to recognize that that's a person in pain. That's a person in pain that doesn't need, I need to normalize the pain I'm feeling because of what they're doing, but I don't want to dehumanize them, because that's exactly acting out what they're doing.
Exactly.
And this is where I really felt how do I, that was the most challenging thing in the whole process for me, is how to not dehumanize them, or how to not dehumanize me, and how to not respond into calling someone out a devil, a toxic person, whatever the labels are circulating now. because that would mean that I've fully acted out what they wanted me to act out. And this is as a really challenging internally, it's extremely challenging to hold that, but then keeping that humanity for me was, if there is a victory, a sense of victory. Which is really basically challenging, I think. And I don't know what you've heard in what I said, but it felt like an addition to what you've mentioned to the whole process.
Absolutely. I have clients who could not hold themselves put together like you said that you did, and then they would feel guilty and ashamed for lashing out, and realizing that the other party actually wanted that, because there was also a sort of gratification. It doesn't have
Some
to be
sadism.
idolizing. It could be
Yeah.
yeah, you still care about me. If you're lashing out, that means that you still care about me. Then they would like blame themselves and be very ashamed. But I think that is also, it's human, it's normal. If you need
Yeah.
to do that, do that. You do it
Yeah.
once, you do it twice, you do it 30 times, you will stop doing it eventually, as long as you understand, you will get there, as
Yeah.
long as you understand what's happening. But I think what you just mentioned is probably, people talk about narcissistic abuse, specifically in terms of this intermittent
Gratification.
rewarding and
Yeah.
gratification, and then molestation, and then degrading and things like that. And that is a very uh, powerful tool that is used for brainwashing. We know that in psychology, it is no doubt that that is super damaging. But I think that what is the most painful for people who are and were in relationships with people with the full-blown severe narcissistic personality disorders is what you just said. They are not doing that to me, they are doing that it is not personal. That is what hurts the most, because you commit yourself to something. Not only that you commit yourself, you go through ups and downs. They are super draining, and you feel like you give the last atom of your energy to fix something, to talk to someone, to explain to them how you really feel, what you really want, that you really care, that you didn't mean it like that, that you really want you to get along and together, and it goes on and on and on, and you spend sleepless nights, and it can go on like that. It is, yeah, really traumatizing, because you're completely drained after that,
Yeah.
without realizing that they do not hear, and they do not care about that, because they do have, unfortunately, that is the part of their illness, a predetermined fantasy that has its own cycles, and the cycles go on: idolization, and then devaluation, and then leaving you, because that is what happened with them, because they were idolized as babies by their mothers. Then for some unfortunate reason they were left behind. Maybe another baby was born, maybe mom got depressed, maybe who knows, something happened, mom wasn't there anymore, and then they that left them in a position where they never went to the process that we call the separation individuation. So they're completely dependent on their mommies as children. They're grown-up children dependent on their mommies, and they think unconsciously. Obviously, it is really important to know that is not their master plan. They're not aware of that, but their unconscious mechanisms force them to leave you as a girlfriend in order to separate from the mother. And then the cycle repeats with you, with another person, with whoever.
Yeah. Yeah.
But that is their repetition compulsion. That is the story of their life that they are not aware of. And even when they become aware of it, it takes a lot of time for them to actually work through that, maybe make different choices.
And I want to ask something specific for our country. So we didn't mention we are from the Balkans, but one thing that clicked to me when I was actually on the trauma course I was mentioning earlier was and it's somehow it's a trauma. It's at least I haven't heard it in our space that has been unpacked, but the trauma of the communist regime. And then when I started thinking about it, it's culturally impaired individuation. And how much of our let's say cultural behavior looks like narcissism or borderline, and how much of our parents' generations have somehow really lost. I mean, I'm not, I haven't grown up in Belgrade, so I guess it might have been different in places where there was a little bit more of let's say space to explore differences. But I feel like in smaller cities that is kind of a predominant way of being, because culturally, if you individuate, if you are somehow different, because difference was not tolerated, then somehow I kind of felt that that was quite impressive for me to realize how it isn't only in the person, how it became a part of the culture. And I don't know if you thought about it, read about something like this, or if this resonates in any way, but I kind of want to explore it because I haven't had the chance to ask anyone.
I don't really think that I don't even know if there is any psychoanalytic literature on how we function and operate in the Balkans. Maybe there is, I don't know, I'm not sure. But I'm familiar with what you just mentioned because, yes, I mean, probably has to do it probably has to do with the fact that our country is poorer than, for example, Western countries. And it is completely normal, for example, in England, when you're 16 to find at least housing benefits and move out, and you're supported by the system, while it is completely normal for 3 generations to live in the same small flat in Serbia. And that definitely influences how you are, what you think, what you expect, how you treat one another. But then there is also a different narrative. We all know that have psychological knowledge that it is very important to help the child individuate, and a good parent help the child go away and live their own life. And that is not something that is expected here at all. And people still say things like that. Young people still say things like that. Like, and it doesn't matter that you don't have a partner, at least get yourself a baby who will look after you, who will take care of
Yes.
you
Yeah.
when you
Oh
get
my God.
old.
That
So
is
yeah, it is
scary.
like,
Yeah.
it is very scary,
Yeah.
and it is still embedded in our culture. And when, at least my experience, when I tried and talked
Mm.
to not clients, but people that I know, relatives, neighbors, whoever wanted to talk on this subject, they
Mm.
all looked at me like, what kind of devilish Western ideas are you propagating here? That's all bad. That's all, America's doing.
Ah, yeah. That
It is that
typical
we all have.
narrative. Yeah.
Yes, that
Yeah.
is the evil coming from America. But we are far from. I think my opinion is, I may be wrong, but I think that we are far from actually accepting that.
Yeah, but also as what you've just described, because again, coming back to again communism, that was just never explored. It almost feels like a black hole that's never talked about, because we talk about wars, we talk about Turkish rule, or
Mhm.
but we never speak about how this regime kind of affected us. And one thing where I can now maybe contextualize what you've just said is when it was dangerous, because if your neighbors can report you to the police, and you can go to very severe, you can go to Goliotok, you can go to through really severe pain. The only people you could trust into was maybe your kind of closest family or your child, because basically all our social mechanisms to some extent were cut off, because the people who were next door neighbors could report us. So there was like a lot of self-monitoring happening.
Yes.
And that's where we kind of become reliant on whatever is in the house. Hopefully that's safe. So hopefully that's trustworthy. And then it ends up being, yeah, your child will take care of you because you have never managed to develop relationships outside of the house that are supportive to kind of
Mhm.
create the village that can support you to sustain. So that was for me, again, realizing how often we are also quite judgmental to ourselves, as in like collectively, and we either it sounds like a very narcissistic cycle. It's like we either completely devaluate ourselves or elevate, but there is nothing in between, and there is very little compassion for the things we have gone through as a country. Because if I think of us, we have gone through slavery. I mean,
Yes.
talking about narcissistic injuries and feelings of helplessness and powerlessness and not having a voice. So in a
Mhm.
way, I kind of see how easy we are to judge ourselves and to degrade and dehumanize, and how difficult it is to have self-compassion, but also how little we actually look at these events that shaped us because they're so extremely difficult.
And what are the outcomes? We, as a traumatized nation, what kind of presidents do we still
Yeah,
pick?
yeah, yeah, exactly, exactly. Which do reflect basically our, well, I can say pathology, but probably, yeah, yeah. And I'm wondering, do when it comes to narcissism, coming back, we have talked about what pathological narcissism is, but maybe just to kind of circle this up is, what is, you've mentioned in the very beginning that healthy narcissism is exploratory, it's kind of trying out the world, but basically, I guess my question is, how do you stay in touch with that healthy narcissism and cultivate it, and also kind of understand the unhealthy parts? And what, maybe if you could talk in that place from your personal development, what did you need to face in order to even be able to work with clients in this way?
Well, I would say that probably the main difference, in a very simplistic way, the main difference between healthy and unhealthy narcissism is that healthy narcissism allows you to be proud of what you achieved, and unhealthy narcissism never allows you to be proud of whatever you achieve, right? Because you have such a horrible sense of self-worth. You hate yourself, you loathe yourself, that you think that whatever you actually achieved is rubbish, must be rubbish. So your happiness about your achievement can be 2 seconds probably, and then you devalue it. And then you constantly have to thrive and go for more and more and more. It's never enough, and it's never enough, and there is never any proper satisfaction.
Sorry,
And
no wonder the song, the Constructa song. Up, up,
right,
up,
right.
always going up.
Yes, yes, that was really, I really like the song. It is really wise, I would say. Um, and I think that is also, you mentioned culture, I mentioned capitalism. That is also something that is supported by the world that we live in, unfortunately. Up, more and more. New, also
Yeah.
new relationships, more partners, more everything, right? Um, so the opposite of envy, as you know, is gratitude. And that is something that is so much easier said than done, because if you
Mm.
mention something like that to a person with a personality disorder, I wouldn't be surprised if they just left uh, your space, therapy space, because you can't train someone to run marathon if they have both broken legs. That is something that is over there. But also I had that. I'm sure that you had that, that everyone, at least
Mm.
at times, had the moments of devaluing our own achievements, which is
Yeah.
unhealthy narcissism, perfectionism, and all that. Could have been better, could have been
Yeah.
more,
And as you're
things like
speaking that, actually my journal has, so I have this journal which has a, like for every day, and it says, there is a part which says I'm grateful for. And I really must admit how much I struggle to find the words. every day to write one sentence of what I'm grateful for.
And it will be probably easier to complain.
Yes.
Oh, what went wrong this day? Like,
Yes.
yeah, that can go on and on and on. And it is something, people say practice that. Again, it is not a psychoanalytic approach to tell our clients to go and write and journal and practice gratitude. I personally think that is not something that can be forced, even though there is a science of forming a habit. If you do something habitually for, I don't know, a month, 3 months, some say even a year, it does not matter. I don't think that you can force yourself to be grateful. You really can't. But you can try developing towards that by at least reminding yourself of what you have, but not when you are suffering, not when you are compensated. Not like, you have to acknowledge what is happening to you instead of lying to yourself. If you're having a bad day, you can still remember that you enjoyed your lunch, but the day was bad, predominantly bad. So yeah, but that is how you cultivate it. That is how you cultivate your healthy narcissism and the ability to be in touch with your actual achievements by valuing your efforts, by reminding yourself that it took and it did. People say, oh, whatever, everyone now has a degree. It was nothing. It was not nothing. We all sat down for hours on end and we were learning hard, and we were facing anxieties and sometimes humiliation by professors who lacked tact and whatnot. So it was not easy. And it is really important to remind ourselves that whatever we achieved took time and effort, and that we should be proud of our achievements.
And also, when you were speaking about gratitude, I remember times when I went to my therapist's office saying, I don't want to be grateful, because when it's used as a gaslighting mechanism, then it's obviously not the right tool. But I think gratitude is something like which comes organically from a space where we can actually feel how beautiful it is to be alive, and to take a breath in and realize I can witness this from this consciousness with this tool that I've been given, and I can do the best from it. So that's where, and that's not something I feel every day, but there are days where I'm grateful that this is what I'm given for this iteration of my experience. And I am grateful that I can experience the world in that way. But I think it's it's like everything in a polarity. If it's used in a way that is gaslighting, that you should be grateful for what you have, look, then obviously people have resistance towards gratitude. But
Especially if you put it like that, like you should be grateful,
yes,
you instantly feel guilt or shame because
yes,
you are not
not.
something that you should be. Yeah.
Yeah, exactly. But I think all of these things come organically, and there are stages in life where we can or we cannot, and I think that's quite like normal in a way. But I agree, and pride. I think that was and is for a lot of the people I work with, and I think especially in science, I see how easily people wash out compliments, and how easily it's almost like there's a Teflon for compliments. And it kind of there is like, oh yeah, but, and then there's always like, and I could see it for myself for a long time, how difficult it was to receive them, but to truly take them in. And now I have kind of created a small folder that I can put those things as a reminder, because it is definitely, it's almost like the wolf you feed eventually
It
wins.
is.
And it's kind of important to have something to touch base on, when things get rough, I guess. I'm wondering, it feels like we have somehow exhausted a topic, but I'm wondering if there is anything else that you feel like we haven't touched but you want to add. And I will also check the questions that I've prepared if I wanted to touch something else.
Yeah. I'm not sure. I feel that we can talk about this topic like
Mm.
endlessly. Definitely, it is a very, very vast topic. Uh, Okay, I would like to know if there is something else that you find very important to mention today, because as I say, I mean, just recently, a colleague, another psychoanalyst, and I held a seminar on narcissism that was just packed with information, and I didn't mention the majority of them because I don't want to like flood.
Mm.
I thought that the idea of this podcast was to maybe try and clarify some things rather than give too many information that would probably create more confusion. I
Maybe,
don't know if you
maybe,
feel.
maybe
Mhm.
I actually saw a nice question, but I want to backtrack with that seminar. What do you think is, let's say if we talk about clinicians, what do you think is the information the clinicians at least need to seek for when it comes to treating personality disorders? And what do you see maybe in the clinical literature kind of not being talked about or in clinical circles that you think should be talked about more when it comes to personality disorders and narcissism?
You mean when you see a patient as a therapist, what
Yes.
is it that you should look for?
Yeah. And also, like, what kind of models do you see are used or misused or not used enough?
I can only fortunately or unfortunately talk from a psychoanalytic perspective because that is what I've been practicing for years now. And I think that I mentioned that previously. I don't know how clear it is, but we are looking for the quality of anxieties and for dominant defense mechanisms in order to see if we're dealing with a personality disorder or people that are more neurotic or people that are more psychotic. How bothered they are with anxieties, what kind of anxieties they are. Are they the ones that make you feel that you're going to be shattered unless you do something like this integrative, annihilating very, very early anxieties? And how often you use splitting and think dichotomously that the world is bad and good, how often you project, how often you blame others for everything, how much in touch with yourself you are, where's your moral? How are your moral values? Do you have friends? What kind friends you have? Are they followers? Are they online? Or do you actually sit with people? Your sex life, your fantasy life, your stance towards money. People find that strange, but it tells you a lot about character.
Mm.
Um, and one thing that we haven't mentioned, I don't know how important that is in other therapies. It is really extremely important in psychoanalysis and psychoanalytic therapies is therapeutic setting, which
Mm.
is that you mentioned therapy saying to the client that he was 30 minutes late
Yeah.
or something, yeah, something similar. But it is important that we have our setting. So 45, 50 minutes, I don't know, that is on the therapist to decide. But if they're going to be on time, if they're going to be early, if they're going to be late, and um, the more problem a person has with boundaries, and personality disorders do have boundary problems and tend to do boundary violations, the more important is that we have a very, very strict setting, meaning that we do not change uh, the scheduled sessions so that the client has his own or her own slot, and that we see each other constantly and consistently, and that we start in time. We therapists, they don't have to start in time, but we have to start in time and to finish in time, because that is something that is a helpful, let's say, technique that gives boundaries
And
that are
container,
lacking and
yeah.
are hard to contain, that are probably hard to communicate, at least early on in the session.
Mm.
That is how we, and also one thing that is extremely important, I believe that other therapists also started introducing transference and counter transference, is how you feel with
Mm-hmm.
the patient, how you feel with the patient, because if you feel extreme boredom, if you are flooded with anxiety, if you feel horrible rage, something is off.
Mm.
Something is off, and you should probably think about projective identification and other primitive, not to go into detail, other primitive defense mechanism that caused you feel like. You can also, of course, feel if there is something wrong with you, which I think is legitimate and normal
Mm.
thing to ask yourself as a therapist, if there is something that is your fault there.
Mm.
But yeah, this is how I assess clients early on
Mm.
in the
And
treatment.
there are two things that came to me from your writing that I wanted to speak about because I found them interesting. I really liked the post where you and I kind of know that a little bit from family constellations, but you mentioned the post of if I was to write parenting book, it would say don't put your children first or something like that. And then there was like a follow-up comment on that, which I thought was quite useful. And maybe you can say something about that, what it means to model to your child that you're taking care of yourself and your own relationships, but not in an extreme way where you're neglectful.
Mhm. Well, that is probably not very different from the topic of narcissism in creating personality disorders, because we usually talk about how children that develop personality disorders were abused and neglected, but there is also a possibility that they were overflooded with motherly care that was not care, suffocated, and whatnot, helicopter parenting, I think it's called. I live for my child, I live for my children. That is such a burden for a child. No child would like that. That's that not even from the day one. That's not something that is pleasant for children. They are not born to be your teddy bear. And also, I mean, that is for the families that are whole families. So assuming that the parents are married with each other still and could be a functional family, it should be normal that mother and father, that is something that I think is good from the patriarchal values that we now tend to completely devalue. I think that is good. Like, we have our parental subsystem and we're going to play with the child, but then the child can go to their, or the children can go to their room and learn how to be bored also. That is a super
Mm.
skill that does not exist anymore because tablets, phones, cartoons, whatnot, just, be bored, do whatever, play with your fingers. I remember doing that when I was small. There is nothing here, I'll play with my fingers. I can find a way to occupy yourself, because if we don't learn as children how to be alone, we're going
Mm.
to have huge problems when we grow up. We are going to, for example, end up in horrible relationships without even considering to abandon horrible relationships, because it is even more horrible to be alone. So
Mm.
it is also important for parents for single parents, whatever, they are not married, um, for whatever reason, to still behave in the same fashion, for mother to have friends or to have to travel or to have work or to have something better to do, to be on
Mm.
the phone with someone and not have time for the child constantly 24/7, because as a neglecting child and abusing child is awful, showing him that he is the center of the world is also, I would say, equally awful. equally awful, because no one will treat that child that way when they grow up, and they will not be able to tolerate this unfairness.
Yeah. Yeah. And the last question I have is one which I think it's a nice way to end, which is how to get in touch with internalized good. And I prefer the Serbian word, the pounutreno, because it's quite gentle, but yeah, how to create that space and get in touch with it in times of need.
I think that we probably talked about it when we mentioned how important it is to have at least one good friend, and to basically to surround ourselves with whatever it is soothing for us. Now, as I say, this does not come for psychoanalysis, at least not that I'm aware of, but I think that these things are extremely valuable, that you have your soothing object, whatever it is, that you have a reminder to relax, that you try as consistently as possible to form habits that are good for you, that you love, that you remind yourself to love what you and who you actually love, to sometimes, we live in the, I think probably this is where the problem lies, and probably this is how could be fixed if we are willing to do that. We live in the culture where we believe that everything should be easy, and that we should enjoy all the time, and also that we should be able to do whatever we want, which makes us super depressed. So I would say that doing the right thing, which is usually the hard thing, is how you actually manage to be content, proud of yourself, nourish your healthy narcissism, your good self-esteem, self-respect, and to maintain relationship with others. So if you have a crazy party coming up, but you also need to help your elderly parents with something, you know what's right to do. You also know what's easy to do. And you know how you will feel when you choose whatever you choose.
I would say this is a really nice way to end, but I just want to check if there is anything. Is there anything you want to ask me, or is there anything that you feel like is left unfinished?
As I say, everything is left unfinished to an extent, because we can really, really talk about it a lot. I think that you covered questions quite nicely. I've enjoyed this. I can say that I'm grateful for this conversation. It really was pleasant. And yeah, and it just the time flies. So I don't know if there is anything I would like to add. I could, but I don't want to suffocate this conversation. If you are happy with the topics that we covered, I just want to thank you for this pleasurable experience.
Well, thank you. And maybe I can invite people who are listening to us, if they have more questions, and if they have burning questions, they can maybe ask us, and then maybe we can find a way to answer them in the future. Thank you so much.
Thank you, Alex.